All right, so we're going to talk about the soft tissues on the posterior aspect of the knee. A couple indications here. So in terminal knee extension, or as the knee's going all the way straight, all of the posterior soft tissues need appropriate functional excursion, or need the ability to lengthen on each other as well as within each of the muscle bellies, and then also surrounding the tendons that are in this area of the various muscles that cross the knee. Okay, so we do that by working on a lot of muscle play. So techniques like parallel, unilateral parallels, perpendicular deformation. We can also, for more specific restrictions, we can also do some muscle bending, some strumming, and then I'll do like a much larger muscle play technique where I'm just kind of wrapping the muscles kind of circumferentially around the bone. Okay, so that's more of an overview. So they need to be able to lengthen, but they also need to be able to shorten. Okay, typically I'll start on lengthening because that gets the knee to a neutral position, and then non-neutral would be basically any flexed position. Okay, so the muscles that we have here is we have medial hamstring, we have lateral hamstring, we have gastroc, and then we have plantaris, okay, or plantaris. So assessing all those, but for me in general, I'm not even necessarily always thinking exactly what muscle I'm on. I'm just kind of looking for restrictions as the knee is in relative extension. Okay, so I would start out just by kind of doing a little muscle bending technique. Okay, and this is more hamstrings, medial lateral. Okay, I can get down on medial head of gastroc, lateral head of gastroc, and just kind of feel what doesn't want to move back there. All right, there's something right here that doesn't want to move, and so that's either medial gastroc, right, or that might be plantaris. I don't know how to say that word. And so I don't mind what it is, right? What I know is that I have a hard infill, right? And so I want to see with that infill, if I take her knee, and let's flex your foot here, Kelsey, right there. If I'm on that restriction and I localize to that hardest infill, I may even be on medial hamstring tendon here as it crosses the knee. That's actually kind of what it feels like. Does that get more taut if she lengthens through her heel, raises her knee up and back down into extension, or does it get more taut into a more flexed position? Okay, and it actually starts to become taut as she first starts working into extension. So raise your knee like ½ an inch right there, and then back down. And so then from here I can go through my cascade of techniques working on freeing up this restriction. Okay, so this is a really quick example of just finding it's not always going to be there, right? You may end up working more so on any of the other structures in the back of the knee, but just checking, especially starting in a little bit of a slight flex position, and then working towards that restriction. Okay, and I don't let them go through that whole range. Just like with any FM, you want to find that barrier and then slightly engage that barrier a little bit more. Okay, so if they're just constantly going all the way through range, that's too much. All right, and they're going to kick you off the restriction, and you're not going to get an effective release of that. Okay, now as an example of working into flexion, I'm going to take her into kind of a relatively loose packed position here. And now in this position, I want to feel, can the soft tissues at the joint line move inferiorly towards her foot and ankle? And conversely, can at the joint line move up towards her hip and pelvis? And she has a lot more restriction in the ability for the soft tissues that are at the joint line and below. It's not necessarily gastroc, because the hamstring tendons cross over that joint line. Okay, so It's just, I'm just kind of generally grouping of like the ability for all of these tissues to move this way as the knee flexes versus all of these tissues to be able to move this way as the knee flexes. Okay, so that's, hopefully that's clear. So if I get on kind of that same area, and now I'm coming in and seeing when that restriction starts, it's about here. And now I can do an FM here. Go ahead and try to straighten your knee out, Kelsey. And I'm just engaging that barrier in the direction of the hardest infill and let it go. And again, hold. Good, and let it go. Okay, and I would keep working through all of the posterior soft tissues until I feel like I have cleared as much as I can before I then go into doing the joint work. So this is working on posterior soft tissues of the knee, lying and prone.